In Chapter 5 of the book, Teeth, the Study of Beauty, Inequality, and Oral Health in America by Mary Otto, she discusses the history of dentistry and how it became a professional industry. Dentistry in America was not common in the early 19th century. People called themselves dentists without any professional experience because there was no formal training to become one. These self-proclaimed dentists went from place to place, seeking out people with teeth problems to help alleviate pain and infection. There was no real solution to these dental problems, as these self-proclaimed dentists did what they thought was right, removing teeth or treating them with dangerous metals. These dentists also preyed on the poor by offering them money to have their teeth surgically removed for rich families. By narrating historical practices of early dentistry, Otto makes a point to show how early development of dental care shaped the pathways for modern practices and to show how important the field of dentistry is to medicine and society overall.
Joseph Fox was an early well-known healer of that time. He was a dental surgeon at London Guy's Hospital, and he published a book that inspired Dr. Harris, which is another notable founder of modern dentistry, to write his own. Both books spoke on the importance of dentistry and the preservation of teeth. Harris's book became the first college dental textbook and the most popular book of its time. He believed that dentistry should require formal education and scientific training. Harris attempted to establish dentistry as a profession alongside the already renowned medical field, yet he was rejected by the University of Maryland and the New York Medical School. With the efforts of Harris and Hayden and their New York colleagues, they made the world's first national dental organization, the American Society of Dental Surgeons, and later on, Harris helped found the College of Dental Surgery of Baltimore with Horace Hayden, Harris's partner and college president.
Many disagreements arose among various members of the association during the movement of dentistry, especially between Hayden and Harris. They disputed research regarding diseases until Hayden died in 1844. Afterward, the amalgam wars occurred, standing out among the disputes of various people in the dentistry field. This led to the fizzling out of both the American Society of Dental Surgeons and the dental profession for more than a decade. Over the years, efforts to integrate dental education into medical education would fluctuate. A rare instance happens where the Dental Department Institute at Harvard was associated with the medical school in 1867. Although the progress was slow, dentistry professionals remained focused on the surgical procedures needed to treat things like tooth decay and oral diseases. They built private practices where many dentists focus on delivering oral health across populations instead of social medicine.
The chapter ends with a suspenseful narration set in the modern era of a boy named Demont Driver and his mother, Alice Driver. The writer captures the reader's attention by leading them to believe that Demont had been cured of a severe tooth infection after an intense and painful treatment by physicians rather than dentists. Then, Demont dies, driving home the point that dentistry is part of a holistic practice that should have been included in medicine since its establishment. This is what dentists and educators like Harris and Hayden had been urging and working for throughout their entire careers. Instances like Demont's death have been happening for centuries and will continue to happen without the marriage and unity of dentistry and medicine.